Today's from Kasia. She's come all the way from Switzerland to deliver this, so thank you very much for that. So Kasia is an expert in breath work. She's a facilitator of psychedelic assisted therapy, and she'll be talking about the relationship between like somatic elements and psychedelics. So take a look at it.
Thank you so much for having me here, guys, from the Psychedelic Society, and thank you all to be here today. You could have been everywhere else, but you chose to be spending this time together with me and with each other, so welcome. I would like to start first with me in Cambridge, back in the days, some time ago between 2007 and 2012. I was here at Hughes Hall doing my PhD in cell biology. It was an exciting time for me. It was like my kind of a huge transformation from going from Poland, where I was born, into Cambridge, into that sort of sophisticated scientific environment. And I have done everything that students in Cambridge do. I did punting, I did tango even, I did a lot of hours in the lab. I met a lot of wonderful people, and it was a super transformational time, but it was also, at the same time, very difficult time for me. While I was here, my kind of history of anxiety and depression kind of blew up as well. I mean, all of you who are studying here, or particularly those who are doing PhD, you know how pressured it is. So this was a time as well, in my late 20s, where I figured, okay, so there's something in me that in that environment of stress and pressure goes a little bit too far into anxiety and then also depressive states. And then I left from Cambridge and kind of fast forward towards 2014, I arrived in Switzerland. And after a few years, I was working there as a cell biologist, also in the lab. I started to struggle with depressions and anxiety again. I had enough money to start the therapy, a kind of a regular talk therapy. But what I figured out is it wasn't enough. And so over that time, I tried everything possible. For me, the breakthrough was breathwork and a training that I took. And then came psychedelic therapy that I actually encountered first with ketamine in ketamine-assisted therapies that I have taken myself as a patient. And that became really not only transformative for my mental health, but it became a passion of mine to inspire people or show with my own example it's really working. It's not like depression, and the depression that is reoccurring with suicidal thoughts and so on, that this is something that one can overcome and you can stabilize, and it's not like I have to take medications until the rest of my life. And so I became a somatic therapist first, and then I started holding groups where people were learning about how to connect with their body. And in that place that you see here, this is also where the group psychedelic assisted therapy happens. So now I work also as a psychedelic assisted therapy facilitator. So I'm not a licensed psychotherapist. I cannot administer substances to people, but I work in a collaboration with a psychiatrist, and we co-facilitate the groups with each other. And this is the elements that I kind of introduce into my work. In a moment, I will tell you a bit more about the legal framework that in Switzerland under which in Switzerland we can perform psychedelic assisted therapy. So in my work, I kind of bring together five elements: somatic work, body work, and I work a lot with touch, also with conscious touch or compassionate touch, attachment and transference. So really, for me, the center is human relationship. The substance, for example, in the psychedelic process, it's sort of a secondary. The most important is what happens between me and my clients. Breathwork is an excellent starting point for people who have not had any contact with psychedelic substances, and more so even, I would say, for those who had contact already, but maybe had some difficult experiences, because it's easier to come in and out of the psychedelic state. And I'll also introduce a lot of elements of expressive arts and ritual that helps to kind of translate this very poetic, dreaming language of the body, of the psychedelic state, into something that makes sense for people. So I will have one slide to talk about the legal framework of PATH, psychedelic assisted therapy in Switzerland. Afterwards, you can ask me questions. So since 2014, there's a special exemption that Swiss Federal Office of Public Health, so-called BA, had open, where we can use for a limited medical use of substances such as LSD, MDMA, and psilocybin in individual cases. There is an organization to which I belong as well, the Swiss Medical Society for Psychedelic Therapy, that very closely works with the Ministry of Health in order to support the training of the therapies and also connect people and make sure that everything is safe and runs appropriately. And at the moment, there are about 80 registered psychedelic assisted therapies in Switzerland, and most of them are actually psychiatrists. So psychotherapists also can provide this therapy. However, because we are giving substances, usually the medical support is appreciated. So mostly it's done by the psychiatrists. And those 80 therapists are officially listed on the website of the organization, so people can directly contact the therapists. And under this framework, we work with the clients in a group, usually between 5 to 8 people. It's recommended that it's facilitated by 2 facilitators, a male and a female. These are the people that we have worked before as well, and that we have established connection, a therapeutic relationship. Most of the time we use MDMA and psilocybin because it allows us to contain the session within 1 day. And there's always a session for the preparation before, the day of the dosing, and then 3 integration sessions afterwards. And this cycle kind of repeats every 3 months. So the clients receive an individual certificate per year. So for each client, it's case by case, and then they can, within that time, undergo several cycles of that psychedelic assisted ceremony or dosing day. But I'm actually here with you to ask you a question. If you have ever wondered what your body is doing while your mind is in a psychedelic state. So today I'm going to be talking to you a little bit about the science. And I love the way one of my teachers talks about the experience. It's not truth and it's not truth. It's an experience. So I would like you to also have that in mind, and some of the storytelling, particularly about the ancient times. And to start the kind of major part of my presentation, I want to invite you to a gentle 5-minute experience, because what I'm talking about is possible to explain in the concepts, and of course I'm going to give you slides afterwards. But the most important is, what does it do to you? What happens in your body? So whoever likes to join into experience, very welcome. Of course, if you don't feel comfortable, just feel free to listen and have your eyes open or kind of float in and out. So that would be an experience about, very simple, about feeling yourself, about your senses outside and inside. So I would just invite you to sit comfortably for the next 5 minutes. And right now, just notice that you're sitting in a space that each of your body is inhabiting a very unique part of that space that we are here. And you can even look around. There's no one else or nothing else in that particular space that you're inhabiting. And notice also that there's an exchange between you and the outside in the form of your breath. So you're sort of, with your breath, taking a space in, and you give it back. Again, the air comes out of your body. So there's always this connection between the outside and inside. And I invite you to notice your senses. So if you have your eyes open, or even if you have it closed, just notice that you have eyes that can see and that you have ears that can hear. Maybe there's some taste on your tongue. You can smell something, and perhaps you can feel the touch of your own hands on your body, or the touch of the object or the chair you're sitting on. And that there's a constant information flow from the outside inside. And perhaps even you can name those sensations, but actually they're not cognitive. So what are they? Those informations that you're receiving now from the external world. And now if you come a little bit closer towards the surface of your skin, and now you zoom in towards your internal senses, and maybe you can feel something inside your body, a tension somewhere in your muscles, maybe something in your belly. And I invite you to check in what is alive inside of you, what informations you can receive just through tuning inside yourself. And I feel a sort of a presence that we now share. Yeah, you can give yourself a little stretch and prepare yourself to come back, just looking around again. Yeah, thank you for that moment together. And please keep that in yourself, in your heart, in your mind for the sessions. It's really about that. In all of this, what I'm going to present, it's really about feeling what we normally filter, what we don't have time, or we kind of miss from moment to moment. And I would like to share also an experience from my own psychedelic trip that was one of, I would say, most significant ones for me. And I will read a very short paragraph from my journal that I have, where I have recorded this trip. And here you see actually a movie from the VR documentary, virtual reality documentary that a colleague of mine did about psychedelic therapy. That documentary you can see with the VR set, and you can really feel how to be in that psychedelic experience. So this is actually done inside my room in Zurich, in Switzerland. So let me read you what I have wrote. I gathered with my dear friend to sit in a magic mushroom ceremony. After speaking out our intentions and going through safety protocol, my friend and I took about 3 grams of the sacrament. We laid down, and after a short 15 minutes, I noticed the familiar sensation in my brain as if the gate had been opened, and I heard a voice from the mushroom, "You are in." At that stage, my body was already extremely fragile. I had to crawl to the bathroom with the help of my friend, who seemed to be functional despite taking the same dose. After getting back to the room, a long story short, I went through the death process, the ego dissolution, then a rebirth. But this is not what that story is about. After about 2 hours, which felt like an eternity, when I could finally move, I noticed that my body lived independently. Everything inside me and outside me was moving. My head, my torso, my hands, my fingers. I felt separate cells moving inside. I had experienced a sensation of being fully intact and simultaneously completely translucid and connected to everything. I was a separate being, but I sensed some kind of a magical force that was flowing through my body. And it was pulsating and undulating with the table, the nuts in the bowl, the air, and the tree outside. And I have never felt so profoundly alive. I mean, at that time, I was already very much involved in the somatic therapy, but this was really feeling my body more than I have ever felt before. And actually, the ancient and still the cultures, the traditional cultures that we know are sort of expert in the psychedelic states, they are using their bodies to come into the state of the ecstatic states or altered states of consciousness, psychedelic consciousness, and they use it also for healing. And I want to give you 2 examples of that from the ancient cultures. We know more and more that they have used psychedelics in the past. And one of them was from about 3,000 years ago in Greece, in the Mysteries of Dionysius called Bacchanalias. And I don't know if any of you is familiar with this god, Greek god, the god of Dionysius. Yeah, and ecstasy, exactly. So a lot of people know him as this kind of guy with the big belly. He was not always this drunk guy with the big belly. He was actually at some point a beautiful man that represented kind of that ecstatic state of transformation. And women called Maeads were the ones that were taking care of kind of his mysteries. And all of them, they drank wine, but it was not just a wine, kind of a regular wine. It was spiked with the psychedelic plants. And after drinking this wine with the psychoactive, we don't know if they were psychedelic, but they were psychoactive, they went usually in the nature and they danced like crazy. They really used their body in order to get into that hyped ecstatic states and then to connect basically with everything, with the nature, with all the other gods, and basically receive healing. And the second one that comes also from Greece, because it's also the closest to our culture, is the Oracle of Delphi. From about 1,700 all the way up to 400 in a common era. Pythias, who were women that were helping to make decisions to a lot of very important people. So those people like politicians, kings, etc., they would travel far away, they would get cleansed before, and then they would meet Pythia, who would tell them give them advice, not in a kind of direct one-to-one way, but there would be a poetry. So it would be a beautiful words that would flow through her body and through her mouth to those people. And it's very likely that also they have ingested psychoactive or psychedelic substances to help them divinate. If any of you is interested about that, I recommend this book by Maria Papaspiru and Chiara Baldini, who are both researchers, Psychedelic Mysteries of the Feminine. So a lot of beautiful stories about using the body and psychedelic states. So actually all these ancient rituals and many rituals also in traditional societies, they kind of go around that what I call regenerative potential. So they take what they see in vegetation and fertility, and they see that there are certain cycles in the nature. And here on the left, they're represented by the vegetation. So from seeds, there's a flower. From flower, there's a fruit. From fruit, there's a seed that drops to the earth, goes underground, and then becomes a plant again. And we all go sort of through those cycles throughout our life, but also in many times in our life, from born to grow, produce or reproduce, die, and then born. And this is also representative actually of the psychedelic journeys very often. So there's that idea about rebirth, right? Going underground, meeting your shadow, meeting your pain, and then being reborn. And that very much is related to a natural world. Again, in this case, looking at the plants, but looking also at our own bodies. And why is that important? I want to cite this man who is a transpersonal psychologist, and he's interested in Taoism. And he wrote here in that paper that this consciousness is embodied is a fact that many psychologists have missed or often omitted, forgetting the soma in the pursuit of the psyche. In order to move beyond the tired dualistic models, so-called the mind-body problem, and work towards recognizing a body-mind continuum, the term psychosomadelcs was utilized. And this a little lengthy name, psychosomadelcs, I really appreciate that word, because this shows us that not only brain is involved in the psychedelic transformative processes, but we have all of it. Brain is also part of the body. And I want to show you how is it possible, or how potentially could it be possible that from very simple molecules, very simple kind of rules, we have received that amazing, complex human being as we are. And I will just play very briefly a movie from the Particle Life. So this is a program that a person wrote where they have particles, very simple building blocks like Legos, and then they give a few rules to those particles, and then they kind of observe what happens with those particles.
Which works in practice. Let's say, for example, that red should be attracted to itself. Now let's say that green should be attracted to red. And then red should be repelled by green. So I think you get how it works. Let's try to create a new structure. Each color should be attracted to itself. Add to the next color. So red to orange, orange to yellow, and so on. I place all of the colors next to each other. Let's just watch what happens. You see immediately all the colors clump together. And they start following each other. All of that snake-like movement just emerged from these simple rules. Take a look at that in slow motion.
No one told them to come together, there was a rule, but how they came together. And then suddenly there's a movement, a really complex movement happening there. And let me go back to my presentation. And this is exactly what is happening in our body. At any moment, we have all those crazy, complex things happening inside our body that our kind of conscious mind or our awareness is completely not showing the direction or not trying to make it work. In fact, why we are here at the University of Cambridge is exactly because we try to understand how the hell does it work. I mean, it's so extremely like intelligent, this wisdom in our body that we, with our brains and our supercomputers, we still cannot figure it out how that whole thing works. And in fact, the man called Gerald Edelman, he was a Nobel Prize winner in immunology, and he was extremely interested in consciousness. He coined these two types of consciousness. One that we all are familiar with secondary consciousness, so-called our explicit self, is who we think we are. So basically, it's me, Kasia, who has a sense of time, who has the ability to think in an abstract way, make meaning. I'm goal-oriented. I can use my voice. That's basically our ordinary adult human mind that is self-reflecting and that is connected to those higher order networks, such as the fault mode network. That is actually filtering all of that, which I have just showed you before, because it's not necessary. Maybe it's not necessary to know all of that in order to survive. And also, it actually takes awareness, takes a lot of energy, brain energy, that we can use to, for example, build this amazing theater. On the other side, what is underneath is primary consciousness, which is not interested in any of that, making meaning or time and so on and so on. It's not really verbal. It's connected to so-called lower brain, so brainstem, limbic system, and or peripheral nervous system, but it's self-correcting. Yeah, so this is very important. Our body knows what to do so that we're healthy, but there's something inside our brain, inside the secondary consciousness, that kind of breaks that ability, and that becomes available to us when we come into the psychedelic process. And indeed, what happens is that in the psychedelic process, our secondary consciousness is calmed down, is put into sleep or weakened, and our primary consciousness, so that non-filtered info can come in. That's why we have all these amazing images and all the sensations and all of that, which is a state actually of high entropy, so high house, because it just everything flows in. There's no segmentation, there's no models, it's just purely what we feel. And this type of consciousness state is not just in a psychedelic state. That's where how infants are receiving reality. Every night we are doing that in our dreams. It happens in psychosis, of course, as well. and it's connected to a creative states. On the other side, the secondary consciousness helps us to build amazing stuff and have control over reality, but it's connected to all those things, or all those kind of mental states that are not very helpful, like depression, like OCD, like addiction, narcissism, and so on. And probably many of you are familiar with Robin Carhart-Harris. He is now in California. He used to be at Imperial College in London. He is very famous for his clinical studies with psilocybin and showing that it actually helps with depression. And in 2019, he brought together all he knew, and he published his theory on how psychedelics work. And this is one of three main kind of theories right now, probably the one that most of the people are convinced that it might be actually. And it's called the Rebus model, relaxed belief under psychedelics. And he calls the brain or the state of the brain that we have when we are in the psychedelic state, anarchic brain. And remember that anarchic brain. So how does it work? Our brain is basically considered the predictive processing machine that creates so-called priors, and these are models of reality that interpret all those sensory informations. So when I look there, I don't need a lot of time to know that this is a chair, because I have a model of a chair in my head. I don't need to come and touch the chair and kind of feel it and so on. I know it immediately. And those priors are also hierarchical. So there are low-level priors that take in all the sensory informations. And there are also high-level priors that are kind of on the top of the low-level priors, which help us to make sense of the reality. And they're connected to what we think who we are, about our worldview and abstract beliefs. And what psychedelics do, they are kind of slowing down or inhibiting or weaken temporarily these high-level priors. So what happens is that we are not anymore that sure about what reality is, and therefore we are much, much more open to new beliefs, much more creative and much more open for healing as well. And he also recently did a study where he, in this paper from last year, where he also tested sort of in a clinical environment this model, and it seems that it makes sense. And I'm going to now quote from his paper. The relaxation of high-level priors necessarily implies a liberation of bottom-up information flow, particularly from intrinsic sources. The word anarchy means without chief or ruler. It is most typically used in political contexts to refer to a state of disorder due to absence or non-recognition of authority or other controlling systems, or absence of government and absolute freedom of the individual. We speculate that the structural organization of the brain and minds recapitulate the organization of social system, just as the free energy principle recognizes the importance of hierarchy inside the brain, so it recognizes it elsewhere in nature. So what he suggests is that actually this hierarchical system kind of represents, kind of like inside out, what we have inside in our brain, this hierarchy. It's also represented in our systems, right? We have some kind of core beliefs on the level of collective level that affects all of us, right? And what are those social systems connected to? Where is the basics of all of that? Some of you might have heard about attachment theory. It has been widely popular recently as well. Actually, this gentleman, Mr. Bowley, he studied in Cambridge, and this is where he coined his attachment theory. And he said that inside each of us, and particularly in mammals, there is this attachment behavioral system that is biologically driven. It's just inside of us. And all of us, when we are born, and later on, based on that, we have those innate attachment behaviors. such as crying and clinging and following and smiling. And whoever of you has a baby, ever had a baby in their hands, you will see that they are trying everything to catch our attention because their survival depends on us, right? Our brain is creating those internal working models, which are richly those priors, so the model of how we attach or how we relate to other people, that are categorized based on how anxious we are about coming closer or how avoidant we are. It's about separation and closeness. So the secure would have secure model is a low anxiety and low avoidance. The one on the right, bottom right, high anxiety is an anxious attachment, so that's someone who would want to be all the time close and merged, otherwise it feels anxious. On the other side is the dismissive avoidant. So this is someone who is not using that attachment system. They are afraid, they feel anxiety of relying on someone else. So they prefer to be really independent and not need anyone. And the fourth one is that there's disorganized, the mess, and we are anxious and avoidant at the same time. And those three states are connected to trauma. Basically, it's this way of organization of our nervous system that is a result of being misattuned with our caregivers. I'm talking about now the developmental trauma or complex trauma. And interestingly enough, there was a second part of the book that synthesized attachment theory with a rebus model, and also Carhart Harris is a co-author of that. So we have those attachment priors, the internal working models inside of us, and under psychedelics, we are weakening those structures, right? These internal working models. So we are actually opened up to the corrective experiences. And they have stated how important, and we see that more and more, how important it is to have right relationship when we come into psychedelic therapy or psychedelic ceremony. It doesn't matter if it's in the context, clinical context, or out of the clinical context. And they suggest that, or they see that this attachment security is a predictor of the outcome. So the more we are connected with the guides or the therapies, the better outcome of the therapy. And that the psychedelics, with those corrective experiences, when we are really open and very creative and open to learn something new, a new way of being together, they are also helping us to rewrite the stories about connection. But what about the body? So what is it about? Why am I talking about relationships and attachment in the context of the body? And last quote that I will give, some of you might be familiar with Stephen Porges. He's a professor of psychiatry. He is a developer of polyvagal theory, which is a theory why there's a lot of evidence from the experience, but not enough research yet that have been done to kind of prove that theory. And that's what he says about expanded state and psychedelics in our current world. Most strategies towards higher consciousness and expanded consciousness are flags of false direction. They emphasize higher brain structures and the cortex, expanding the use of cortical activity, and deny our body's underlying fundamental components. First, we need to claim our evolutionary heritage. Once we do, we understand that our bodies calm down through a social engagement system with trusted others. Reaching higher states of consciousness requires a physiology that is not in a state of threat, and we need to enter these states not through dissociative but calm states. And just a food for thought, in many psychedelic processes, we actually also as sitters are encouraged actually to leave our clients to themselves in a way. And what does it mean? Where does it come from? Yeah, and what would be another way of working with people? A few more slides. You are still awake. Polyvagal theory. So a lot of research about our higher brain, a little bit about limbic system as stem, brainstem, not so much about autonomic nervous system. And I just learned that in a few weeks there will be another talk of someone who's doing actually research on DMT and autonomic nervous system. Yay! It's one of the first papers that actually tackle this, how does it work? So this polyvagal theory tells us about one nerve that starts in our cranium and goes all the way through all our organs. It's called wandering nerve, vagus nerve. Goes all the way through our heart, through our digestive system, until the perineum. And this is a part of parasympathetic nervous system, and it has two branches. The branch that is evolutionarily younger is a branch connected to the social engagement system. So this is all of that basically supports the attachment of the infant to the caregiver. And that means looking into the eyes, moving the head, sucking, and so on. And this is actually, in a healthy environment, this is the first that we turn to. If everything is okay, it's not to be by ourselves, it's to be in the group and to ask the loved ones or your tribe for support if you're under distress. But there's also a second part of that nerve that is connected more to the lower part of the body. So the safety part is head and chest and heart, and the lower part comes in when there is a real life threat. So if you have ever seen maybe a cat that is playing with the mouse, you cut the mouse and they kind of play with the mouse, and then at some point the mouse kind of looks like she's dead. She's just not moving, yeah? And suddenly the cat maybe loses interest because she's just dead, and she's just start kind of waking up and running away. So this part of the vagus nerve, what it does, it makes the body to support to secrete internal opioids to cut the pain in the moment where there's nothing to do. It's just dead, like we're going to be dead. And then there is a second part of the autonomic nervous system, which is a sympathetic part, which comes in a famous flight and fight, in the danger, in the stress. And this one is related to our spine and the nerves that are kind of going from the back of our body. The social engagement system is the first to kick in, particularly in mammals, and the freeze collapse in life-threatening situation is the oldest. And this is how I wanted to show you this beautiful picture of how the engagement system looks like, those nerves. So you can see that they are connected from the heart all the way to our larynx, to our facial nerves, to the eyes. So it's here that, like, our head is our engagement system, right? This is how we become intimate with each other. So these three states are kind of a basic states, but they're also mixed states. And some of them are really cool. So if we mix the dissociative state with the calm state, we receive a state of meditation, intimacy, a stillness. And if we mix the safety of the engagement system with the danger, it's an excitement, there's play, and there's work, passion. And of course, we want a lot of those states. However, there are also toxic states that are connected to a lot of diseases. This is particularly visible with people-pleasing. I'm one of them. Performance-driven people, this would end up in a burnout. And the toxic bliss is connected to all the addictions. So what happens when we bypass our pain through pleasure? And the combination of the life threat and the danger system is so-called toxic freeze. And this is in a theory of trauma or trauma healing very important. So the toxic freeze has sort of like two levels or two steps of going underground. The first one is where we still feel something. We feel depression, we are suicidal, we feel panic. And the lower part of that is where we are functional. You seem to be a completely normal person, but you are dead inside. You feel nothing. And you might hear sometimes from the people that have been in depression for a very, very long time, they will tell you, that they are not sad. They just don't feel anything. Yeah, and these are bodily states. They are all connected to what we feel, right? To how our heart works, how we breathe, and so on and so on. So putting this all together, I would like to propose, when we think about psychedelic therapy or psychedelic ceremonies, we think of the brain, of course, and these models, but more so we think about how to provide an environment where there's a personal connection possible, and also transpersonal. I mean, the attachment figure can be also a god or an angel or something that you will see in your ceremony. And how, when we kind of calm down this secondary consciousness, these models, what comes out? What is it that is happening inside of us? That is, in my opinion, and how I see it with my clients, also very much related to the body and the autonomic nervous system states. So how I imagine in the integral therapeutic process, and this is the way I work actually with my clients, I start with them always first to connect with their body. So when they come to my practice, we are first working on the attachment and on the way of them feeling themselves. How can you feel what is inside of you? What is your body doing? What is your belly doing? And how to talk about it as well, because we don't actually have a language of our internal life. So that means that I also have to work a lot about on my own attachment issues, so that I can provide for my clients a corrective experience. And I find it very, very good to work here with breathwork, but also working with low levels of ketamine, sprayed ketamine, and low levels of cannabis. They help to kind of break through this very often with many clients, extremely rigid sort of secondary consciousness. We can come into working either in a group setting, mostly it's a group setting, or one-to-one with psilocybin and MDMA and sometimes ketamine to challenge core identities, so all the structures, so your belief system basically, and further strengthen the relationship not only in the therapeutic container, but also outside with your loved ones. With new people, maybe you're completely alone and you're developing your support system outside. And really the cherry on the top, in my opinion, is, and that doesn't mean that you need to do two of the first things for thousands of years before you go into high doses of particularly psilocybin. I find a beautiful medicine. I'm a fan of psilocybin, not so, but it can be LSD, of course, or mescaline. Where we can kind of explore a meta-level topics. Who am I? What is my contribution? These are also the topics that come out with the people that are in depression or in anxiety states. And how can I express myself creatively into the world? And how can I bring service into the society? How can I expand myself from just me and my ego towards the outside and be even more connected in this 3D world, and maybe spiritual world, if that's your need or your desire. I'm going to show you now a video that comes from an institute that I'm working with, Psychedelic Somatic Interactional Therapy Institute, where you will see someone who have inhaled cannabis, and where the facilitator, the guide, is supporting them in coming to their body and sort of go through so-called autonomic waves, so going into a state of the stress, and then allowing the pain to reappear, and then going into relaxation, rather than going up and then going down into dissociation and not feeling anything, like that happens in trauma.
Whole slow motion wave, and then goes all the way down into my digestive system, freezing everything. And a slow motion wave, now it's going to the right, like a cold, icy,
freezing things.
Yeah, it's just flowing over to the right now, freezing everything in its path.
Does that mean it freezes emotions as well, or just body?
Everything like spark.
Okay.
So just notice how she just talks about her body feelings. There's nothing brainy about it.
Oh, it's like a fist.
Yeah.
So now she's touching on her pain, on that stress time in the past where she couldn't hold it.
It's really fast. Oh,
Scary. Stay right there. If you need my hand, I'm right here. Stay with it.
it's fury that's protecting me. It's so bad.
Let it do it all by itself.
It's like the fear is underneath the fury.
Let it all surprise you. Yeah, confusing, fury, and fear all at the same time.
Come back to life. The tear on my eyes.
So she came back to that relaxation state, but she still feels herself. She's not dissociated. And maybe you could appreciate also the guide. The guide was really like a parent there. He was there. He was not trying to rescue her, but he was saying, I'm here, I'm right here. And that's what very often happens. This is a student, so she had done probably many of those sessions before, but often the clients, it's completely new for them what is happening there. And I'm actually making a difference if they are capable in staying with that pain and then allowing to do it all by itself, meaning allowing the body to do its work and then come back to the relaxation state. And this is my almost last slide. I just want to, for those of you perhaps that are here from the European Union countries, I encourage you to have a look at that initiative, European Citizen Initiative. It had the kick-off meeting yesterday at the European Parliament, where a bunch of doctors and scientists are trying to help Europe to catch up with US, particularly in terms of legislation, in terms of funding for research, and hopefully legalization of the psychedelic assisted therapy. So if you are interested, you can have a look and maybe even sign the petition. And with that, I'm very happy to take any questions from you if you still have some juice inside and aliveness to ask. And of course, feel free to contact me at any point as well later on. Thank you. Thank you for saying that one. Yeah.